Ladies and gentlemen, but today I want to speak especially to the men watching. Let's talk about something most men won't discuss openly, but that almost every man over 50 quietly wonders about. What really happens to your body when you go through a long stretch without sexual activity? Maybe you've been single for a while. Maybe health issues have changed things, or perhaps life just got complicated and intimacy took a back seat. Whatever the reason, you've probably heard the phrase use it or lose it and wondered if there's any truth to it. I'm Dr. Sarah Malik, a urologist with 12 years of experience, and today I'm going to give you the honest, science-backed answer. And I promise you, much of what you've heard is completely exaggerated. But there are some real changes that do happen, and it's important you understand them. Stay with me, because by the end of this video, you'll know exactly what's myth, what's real, and most importantly, what you can do to maintain optimal health and vitality, whether you're sexually active right now or not. Let's start by clearing up the biggest myths I hear in my clinic almost every week. Myth number 1. If you don't use it, it'll stop working completely. Here's the truth. Your body doesn't simply shut down because you've taken a break from sexual activity. You're not going to wake up one day and find that everything has permanently stopped functioning. Your tissues, your nerves, your hormonal system, they're all remarkably resilient. As a urologist, I've seen men who assumed the worst and were genuinely relieved to learn that what they were experiencing was not the end of the road. Far from it. Myth number 2. If I go too long without sex, my libido will disappear forever. Again, not true. Yes, hormones and psychological factors play a role. But taking a break from sex doesn't doom you to a lifetime of zero desire. Your body is adaptive, and desire can and does return when circumstances change. I've watched patients in their 60s and 70s reclaim vitality they thought was gone, because they understood what was actually happening and took the right steps. Now, here's what is true. There are some real, measurable changes that can happen to your body during extended periods without sexual activity. These changes aren't catastrophic, but they are worth understanding so you can take simple, proactive steps to maintain your health. Let me walk you through the biology in plain language. No medical jargon, I promise. Your entire reproductive and urinary system depends on 3 things: blood flow, muscle tone, and hormone levels. Think of these as the 3 pillars holding everything up. When you have regular sexual activity, whether with a partner or on your own, you're essentially doing maintenance work on all 3 pillars. Sexual arousal increases blood flow to the pelvic region. That increased circulation keeps tissues healthy, elastic, and well-nourished. Think of it like watering a plant. The tissues stay supple and responsive. When you reach climax, your pelvic floor muscles contract rhythmically. These contractions are like a natural workout for those muscles, helping them stay strong and toned. Strong pelvic floor muscles are critical not just for sexual function, but also for bladder control and overall core stability. And finally, sexual activity interacts with your hormones in complex ways. Testosterone, the key male hormone, influences desire, energy, and even mood. Regular activity helps keep these hormonal pathways active and responsive. Now, I know some of you are thinking, okay, Dr. Malik, so what actually changes if I'm not sexually active? That's exactly what we're about to cover. But first, if you're finding this helpful, please hit that like button, subscribe so you don't miss future content on men's health, and drop a comment below. Tell me, where in the world are you watching from? I genuinely love seeing this global community of men taking charge of their health. Let's break down the 4 most common changes men experience during extended periods without sexual activity. Change number 1, blood flow and tissue health, the biology. Your penile tissue contains something called smooth muscle. This tissue needs regular oxygenated blood flow to stay healthy and elastic. During an erection, blood rushes into the tissue, stretching it and keeping it flexible. When you go for long periods without erections, and this includes nighttime erections, which are actually nature's way of doing maintenance, the tissue can start to lose some of that elasticity. Think of it like a rubber band that hasn't been stretched in a while. It still works, but it might feel a little stiffer at first. The practical reality, some men notice that after a long break, erections might feel less firm initially, or it might take a little longer to achieve full hardness. The good news? This is usually temporary. Once you resume activity, blood flow improves and tissue responsiveness typically returns. The emotional impact, this can be genuinely worrying the first time it happens. You might assume something is permanently wrong. But as a clinician, one of the most meaningful things I can offer is this: understanding that it's a natural, reversible response to decreased activity can ease an enormous amount of anxiety. I've seen that relief on men's faces in my consulting room more times than I can count. Knowledge is powerful medicine. Change number 2, pelvic floor muscle tone, the biology, your pelvic floor muscles. The ones that control urination, support your bladder, and play a role in erections and climax. Benefit from regular contractions. When you orgasm, these muscles contract rhythmically, keeping them toned and strong. The practical reality, when you're not sexually active, you might notice subtle changes in bladder control. Maybe you feel a slight urgency you didn't feel before, or occasional minor leakage when you cough or sneeze. These are signs that the pelvic floor muscles aren't as toned as they could be. The emotional impact, for many men, any change in bladder control feels deeply embarrassing. But here's what I want you to hear from me directly. This is incredibly common, it's treatable, and it does not mean you're experiencing irreversible decline. I've helped hundreds of men address this, and in most cases, simple targeted exercises made a significant difference within weeks. Change number 3. Testosterone and hormonal balance the biology. Testosterone levels naturally decline with age, but regular sexual activity helps keep the entire hormonal system engaged and responsive. Some research suggests that men who remain sexually active tend to maintain slightly better testosterone levels, though the relationship is complex and still being studied. The practical reality, during long stretches without activity, some men notice they feel less motivated, less energetic, or just generally flat. Libido can decrease, which creates a cycle. Less desire leads to less activity, which can further decrease desire. The emotional impact, this can feel like you're losing a core part of your identity. Many men tell me they feel less confident, less like themselves. But I want you to understand, this is often hormonal, which means it is frequently treatable. That knowledge alone can be a turning point. You are not broken. You are simply experiencing something your body can often be helped through. Change number 4, psychological and relational affects the biology. Sex isn't just physical, it's deeply connected to mental health. Regular sexual activity has been linked to lower stress levels, better sleep quality, and improved mood. Part of this is due to the release of hormones like oxytocin and endorphins. The practical reality, men who go through long periods without intimacy sometimes report feeling more stressed, more isolated, or experiencing poorer sleep. If you're in a relationship, the absence of physical intimacy can create emotional distance that's hard to name but very real to live through. The emotional impact, this is often the hardest part. Sex is about connection, vulnerability, and feeling close to another person, or even to yourself. When it's absent for whatever reason, many men experience a quiet but profound sense of loss. And because men so rarely speak openly about this, that loss can feel isolating. You are not alone in this. It's something I hear regularly in my practice, and it matters. Here's the most important thing I want you to hear today. For most men, especially those in their 50s and 60s with reasonably healthy hormone levels, these changes are not permanent. Your body is remarkably adaptive. When you resume sexual activity, whether with a partner or through self-pleasure, blood flow improves, tissues regain elasticity, muscles strengthen, and confidence returns. However, if you're dealing with significant age-related testosterone decline, or if you have underlying health conditions like diabetes or cardiovascular disease, the changes can be more pronounced and may require medical support. And that's completely okay. There is help available, and seeking it is a sign of wisdom, not weakness. Whether you're currently sexually active or not, here are 4 practical steps to maintain optimal health. 1. stay physically active. Cardiovascular exercise improves blood flow throughout your entire body, including the pelvic region. Strength training helps maintain testosterone levels. Flexibility work supports overall function. Even a brisk 30-minute walk daily makes a meaningful difference. Movement is medicine, and one of the most accessible forms of it. 2. Practice pelvic floor exercises. You don't need to be sexually active to keep these muscles strong. Simple Kegel exercises, contracting and releasing the muscles you use to stop urination, can be done anywhere, anytime. 3 sets of 10 repetitions daily is an excellent starting point. Many of my patients are surprised at how quickly they notice a difference. 3. Consider solo activity. Even if you're not in a relationship, maintaining regular sexual function through self-pleasure helps preserve blood flow, muscle tone, and hormonal responsiveness. There is no shame in this. I say it plainly as a clinician, it is legitimate health maintenance, and it matters for your well-being. 4. Get your hormones checked. If you're experiencing persistent low energy, decreased libido, or mood changes, please ask your doctor to check your testosterone levels. If they're low, hormone replacement therapy might be appropriate, and for many men. It can dramatically improve quality of life. Don't wait and wonder. Get the information and work with a professional you trust. While most changes are normal and reversible, there are a few warning signs that require prompt medical attention, sudden, complete loss of the ability to achieve erections, including morning erections, pain or discomfort with erections or ejaculation, significant changes in urination such as severe urgency, pain, or blood in the urine, profound fatigue, depression, or other symptoms that interfere with daily life. Please don't ignore these signs. Erectile dysfunction, in particular, can be an early warning sign of cardiovascular disease. Your body may be trying to tell you something important about your overall health, and it's worth listening. I want to address something that doesn't get talked about enough: the emotional weight of these changes. Many men tie their sense of self, their confidence, their identity to sexual performance. So when things feel different, it can trigger deep feelings of inadequacy or shame. You might feel as though you're becoming less of a man, or that your best years are behind you. Let me say this clearly, and I mean it. Your worth as a man is not measured by sexual frequency or performance. Your body is doing exactly what bodies do. It's adapting to circumstances. With the right understanding and sometimes simple interventions, you can maintain vitality and function for many, many years to come. I've sat across from men in their 70s who had convinced themselves it was too late. It wasn't. I've worked with men in their 50s who thought they were facing permanent loss. They weren't. What made the difference wasn't a miracle. It was information, action, and the willingness to ask for help if you're not currently sexually active because of circumstances beyond your control. Maybe you're single or your partner has health issues. You have more options than you might realize. The 4 steps I've outlined above are not just for men in relationships. They are for every man who wants to age well, feel vital, and take care of himself with the same commitment he brings to every other part of his life. You don't have to accept decline as inevitable. You just have to be willing to understand what's actually happening and then act on it. I'm Dr. Sarah Malik, and this is what I'm here for. Take care of yourselves, gentlemen. You deserve it.